One of the first questions I ask my patients is, what is your most important asset? And without fail, patients tell me that it's their health. However, when I go to ask them the question, what is health, they hesitate. So some of them tell me that, it's how they feel, and whatever response that they can give me. But for the most part, they associate health by how they feel. And then when I ask them to take a look at the network of people that they hang around with, they realize very quickly that a lot of the people that they know that felt great ended up being diagnosed with maybe cancer, diabetes, or high blood pressure, and maybe even died of a heart attack. So very quickly they realize that health shouldn't be based on how you feel. So what is health? Health should be based on function. And this is what we do as chiropractors, is that we try to identify what your baseline is in terms of function, and then work to increase that function and increase your quality of life. And that's what happens when you have increased function. You start to feel better indirectly, not because we gave you a pill or whether it's a Tylenol or an Advil to make the pain go away and make you feel better, but know deep down that the cause is not being addressed. My name is Dr. Clayton Roach, chiropractor and proud owner of Roach Chiropractic Center. For the last 10 years, we've been assessing patients and finding out really the true cause to their illness and why they're in pain and why they're struggling to get back to the lives that they once knew. In 1999, I was playing soccer for university, and I went into the corner for a ball, and I remember stretching out my leg for the ball and feeling that searing pain going from my lower back down to my leg, and I immediately crumbled to the ground, afraid of moving because I couldn't endure any more pain. I thought if I move, I'm going to be in more pain than I am right now. So after being escorted off the field and told to go to a medical doctor the next morning, I did so as a good patient does. I listened to everything that they said. I went to the doctor, but all that was given to me was a prescription for a muscle relaxer and a painkiller. And I took those, I filled a prescription, I took those, nearly failed 2 exams while under the influence of these drugs, and quickly realized that this wasn't for me. So I tried other therapies to no avail. I was still struggling, barely being able to sleep at night. And in the back of my mind, I was thinking about my dad, who had had multiple back surgeries, and I remember thinking to myself, oh my gosh, is this the genetic problem that's starting to manifest in me? And I had all these worrisome thoughts in my head. So one day I was going up the stairs of the science department, and I met this gentleman who was coming down, and he saw me all bent out of shape, and he dared to ask me what was going on. And so I explained to him what had happened. I was playing soccer, and I told him the whole story. Well, lo and behold, he was coming back to university, having thought for 10 years, being an educator, to take a few more science classes to get accepted to chiropractic school. And he then proceeded to tell me that his brother was a chiropractor in town. So he mentioned that his brother, who was a chiropractor, would see me the following day, which I said, you know what, I have to do something. I am not feeling that great. So I go to the chiropractor, and I go in, and it isn't what he did more than what he said. And he says, you know what, Clayton, you're at the right place. We're going to take care of you. We've seen many people in your condition and had phenomenal results. So already I kind of felt more at ease. What he did after, he did an exam, he did a thorough health history, and basically told me what was wrong, what could I expect, how long it was going to take, and of course what the cost was going to be. He then invited me to come back and get my first chiropractic treatment, which was called a chiropractic adjustment. And for the first time in 2 weeks, I was able to go home and actually sleep through the night. After the second appointment, I was able to go back and practice, and after the third adjustment, I was actually able to play again. So to me, that was totally, revolutionizing, and totally changed the way that I thought about health and sickness. So much that after I played my first game, after injuring myself, I went back and changed my course load, full load of science, in order to get accepted to chiropractic school. So I've been doing this for 10 years, since 2005, and I've liked every single minute of it. I feel very responsible when people come in and they're struggling. I take that very seriously, and I make sure that, you know, every year that I learn from the greats in my profession, and I always promise my patients that I will always give them the best quality chiropractic care that I can. So I invite you to take action, you know, to click on the link that's going to be provided in this video, go to our website, download our free report. All you need to do is give us your name and email. We'll stay in connection with you. You'll get the free report in exchange. And if you're looking at this video and you feel like I'm talking to you and you're having, you know, struggles and you're not living the quality of life that you feel you should be living, take further action. Call us. Give us a call. We'll sit down with you. We'll do a thorough examination, a health history. We'll make you feel comfortable that you're at the right place, and then hit the road running with a treatment plan that's going to be conducive to you getting your health back. Again, my name is Dr. Clayton Roach. I've loved spending time with you, and I hope to see you soon and create immense value for you.